What exactly is identity disturbance and how does it relate to borderline personality disorder? Let's get into it. We're going to be discussing this article right here, Understanding Identity Disturbance from Very Well Health, written by Emily Brown. Identity disturbance describes an incoherent or inconsistent sense of self, and it's associated with BPD as it's a criteria for the disorder. It often shows up as a consistent and remarkable change in a person's beliefs, values, and behaviors that significantly can impact them. And more studies are definitely needed because it's such a complex topic. Definition of identity disturbance. So, identity refers to a person's sense of self. Your identity is how you see yourself in the past, future, and present. And it's generally consistent over time. A strong sense of self helps you maintain relationships and commitment and behave in predictable and consistent ways. And in the DSM-5, it's defined as a markedly and persistent, unstable sense of self or self-image. This can show up in dramatic changes to self-image, views, values. However, there are still things that vary within identity disturbance from person to person. As stated earlier, more research is definitely needed. Identity disturbance is one of the 9 criteria for BPD, but if you don't have it, it doesn't necessarily mean you don't have BPD, as you need 5 of the 9 criteria to be diagnosed. And identity disturbance can be difficult to define because a sense of self and identity are so complex and can somewhat be open to interpretation. But these are some symptoms of identity disturbance, such as contradictory thoughts, feelings, behaviors, changes in values, lack of commitment, feelings of emptiness, lack of core existence, lack a sense of I, me, myself, feeling a painful lack of consistency in self, role absorption, where you always find yourself playing a role. And the critical aspect of identity disturbance is that it gets in the way of your daily functioning, such as difficulty maintaining relationship commitments or what you want in life or who you even are. And a person with identity disturbance may behave inconsistently because of their difficulty in maintaining a sense of identity. And of course, to a degree, some of these things are normal to have changing thoughts, beliefs, self-image as we grow and develop. But this is a very significant difference to where it's adversely affecting and impacting this person's life. It's getting in the way. It's not helping them grow. And identity disturbance is a key symptom of BPD, but it's unclear whether identity disturbance can exist on its own. So it's difficult to parse out what exactly can cause identity disturbance. It may be that the key components of BPD, such as emotional instability, which in itself can lead to unstable moods, behaviors, and relationships, causes someone to struggle with identity. For example, if someone experiences unstable behaviors, emotions, maintaining relationships, and a daily routine, for a job example, it's difficult. This can lead to a sense of unstable self-image as interpersonal relationships and commitments impact how we see ourselves. Some causes in BPD might also be shared in identity disturbance because the two are intertwined. Causes of BPD include family history, brain chemistry, environmental and social factors like traumatic life events, instability, invalidating relationships, hostile conflicts. Overall, the exact cause of identity disturbance isn't well understood. There is that association with BPD that does lend some insight. And since identity disturbance is such a key component of BPD for most people that have BPD, the same treatments that work for BPD can really help with identity disturbance, such as DBT, dialectical behavioral therapy, cognitive behavioral therapy, mentalization-based treatment, transference-focused psychotherapy, schema-focused therapy, and medication isn't usually used to treat BPD, but more so certain symptoms or other things that maybe are comorbid with it. And here's a quick little summary. Identity disturbance and living with these symptoms can be very difficult to deal with on a daily basis. It's a struggle, even with treatment. But sometimes just understanding more of what we're dealing with can really help take some of that weight off, just really understanding. I hope this was helpful, and I'm sending lots of love to you all.